Hi there, in this video we are going to have a brief overview of the acid base disorders. We are going to have a brief overview of acid base disorders. So acid base disorders include either decrease in pH which is acidosis, either decrease in pH which is acidosis, or increase in pH which is alkalosis. So acidosis, it can be either metabolic, or it can be respiratory. In the same way, alkalosis, it can be either metabolic or it can be respiratory. Okay. So metabolic acidosis is due to decrease in bicarbonate ions, while metabolic alkalosis is due to increase in bicarbonate ions, while respiratory acidosis is due to retention of carbonic acid or H2CO3, while respiratory alkalosis is due to our excretion of carbonic acid H2CO3. So this decrease in bicarbonate ion, it can be due to production of body acid or metabolic acid. It can be due to production of metabolic acids which consume this bicarbonate ion. Metabolic acid produced inside the body consume this bicarbonate ion, due to which bicarbonate concentration inside the body declines and metabolic acidosis occurs. Okay. So common causes of metabolic acidosis include decay or diabetic ketoacidosis, in which beta hydroxybutyric acid and beta hydroxybutyric acid is produced, and it leads to the acidosis inside the body. So decay is a prominent cause of metabolic acidosis. Moreover, kidney failure can also cause metabolic acidosis, because renal mechanisms are impaired and there is decrease in bicarbonate because bicarbonate is not reabsorbed and so on. Moreover, lactic acidosis due to production of lactic acid can also cause metabolic acidosis. Okay. And severe diarrhea can also cause metabolic acidosis due to loss of bicarbonate ions. In diarrhea, bicarbonate is lost and it can cause metabolic acidosis. Okay. So what are causes of metabolic alkalosis? Metabolic alkalosis can be due to severe vomiting which causes loss of gastric contents, and it can be due to hypokalemia, or it can be due to IV administration of bicarbonate. Okay. So why respiratory acidosis occur? It is due to retention of carbonic acid, and this carbonic acid can be retained due to respiratory issues. These respiratory issues can be asthma, when there is not proper ventilation, not proper gaseous exchange. It can be due to asthma, it can be due to pneumonia, it can be due to cardiac failure or circulatory collapse, it can be due to airway obstructions, or it can be due to respiratory center depression, or depression of respiratory center by drug overdose, and so on. While respiratory alkalosis occurs due to hyperventilation, which blows off excessive H2CO3, and this hyperventilation can be due to anemia, or it can be due to high altitude, or it can be due to certain drugs. So these are different causes of alkalosis and acidosis. So what is the compensatory response of body to these issues? First we should know the anion gap here. Anion gap is basically difference of sodium minus bicarbonate minus chloride ions inside the body. So in metabolic acidosis, different acids are produced which consume bicarbonate, so bicarbonate here decreases. So this difference increases, as a result anion gap in metabolic acidosis increases up. Okay. So next we come on towards the compensatory mechanisms. So in metabolic acidosis, there is decrease in bicarbonate. So how it will be compensated? Initially, there will be hyperventilation. Initially, there will be hyperventilation to blow off carbonic acid and to try to maintain the pH, and then kidneys will play their role. Kidneys will increase the excretion of H positive ion and reabsorb bicarbonate ion. How respiratory acidosis is compensated? In respiratory acidosis, respiratory system is not properly working. So in this case, a dominant role will be of kidneys. However, in acute cases, respiratory mechanism will do play a role. However, in the long term, the predominant role will be of kidneys here to reserve more bicarbonate and excrete titratable acids and NH4 and so on. So what is the compensatory mechanism of metabolic alkalosis? In alkalosis, bicarbonate is increased. Okay. So initially, what will happen? Initially, there will be compensation by respiratory system, which will cause hypoventilation, and then in a long term, in a few days, kidneys will play their role, and kidneys will excrete bicarbonate and try to maintain pH. And in respiratory alkalosis, here the compensatory role will be main compensatory role will be renal. Initially, in our acute cases, respiratory system will do play its role, but the predominant role will be of renal system, because the respiratory system will already be affected in one way or other. So it was a brief overview of the different acid base disorders and their compensatory responses. Thank you.